Thank you so much, Anne, in there. Today, I am so excited to have Natalie Conde, the Director of Telemedicine at Novant Health, with us. So she's been managing multiple urgent care clinics across their state, as well as their statewide virtual primary care platform. So again, Natalie played a key role in the recent rebranding, the deployment, the updated virtual urgent care app. Again, she's also a board certified obstetricity medicine for over 16 years of clinic experience, including working in emergency medicine, hospital medicine, cardiology, trauma, surgery, and so on. Again, we're so delighted to have such an accomplished individual who have done so much in healthcare technology with us. But some fun fact, um, Natalie, something you probably don't know her, she has been an avid ballerina for 16 years until she had a knee injury that's forced her to stop. So I could say is I'm definitely she's the first guest I've interviewed. I think hundreds of them. It's the first ballerina I have interviewed, and she began her medical career as age of 13 when she started volunteering in her local hospital, doing the candy stripper in this. Again, Natalie is also rooting for the Chicago Bears. So welcome, Natalie. Thank you so much for joining our webinar. I was so honored to have you here. Maybe we can start off by just having you probably share some background, share the stuff, wonderful work you've been doing.
So, hi everyone, I'm Natalie. I've been the director of telemedicine for almost 3 years now. We've gone through a lot of changes, and VSee has been partnered with us hand in hand through those changes and really has brought great care to our community as well as to our patients that we serve within the state of South Carolina. I'm honored to be here today to share the things that we've accomplished as well as some insights from our accomplishments and our partnership with you all. I have been a PA for 16 years. I am rooting for the Bears. Go Bears. Hopefully we see the Super Bowl this year. Next slide. So the objectives today, we'll talk about how the urgent cares were supported with the help of telemedicine, especially during our peak volume times. We'll also talk about how the technology enhanced our patient visits within the clinic as well as throughout the community. We'll also talk about the impact that it had within the rural communities and their access to receiving care due to limitations of distance and the drive, since a lot of people in the rural locations are further away from our brick and mortar locations, and then some lessons that we learned throughout that time. Next slide, Anne. Okay, that's a little bit about me. I'm a boy mom. I have 3 boys. One's in college, and then I have 2 others who are eating a lot at home, and then we just recently adopted a puppy. Her name is Phoenix. Next slide. So a quick show of hands, how many of you remember the Jetsons, and whoever thought that telemedicine was just a cartoon idea back then? We're gathering data. I'm dating myself by mentioning the Jetsons. So that was over 60 years ago. Whoever thought that we would actually have visual technology to see a doctor or to talk to a family or anything like that now today in 2025. All right. All right, so about 55% of you remember it, and it seemed like sci-fi, 14%, and then 18% heard of it. Okay. I'm gonna play a little clip.
Hold on, I'll call the doctor. Calling Dr. Bracey, Dr. Ken Bracey. Yes, Mrs. Jetson, somebody got a pain in the belly downtown?
It's Elroy, Doctor. I think it's the Venus virus this time.
Venus virus? Oh, that can be catching. All right, Elroy, this is your dedicated physician speaking. Stick out your tongue. Uh-huh.
So as you can see, the cute little clip of Jetson's Elroy was being seen because he couldn't go to school. That's what telemedicine does for a lot of moms and teachers, as well as the community who have busy lives, busy schedules, have to manage. That telemedicine definitely bridges that convenience for easy and simple cases that can be seen. Next slide. I'm keeping you guys real interactive during this presentation today. So if you could avoid sitting in a crowded urgent care waiting room, how many of you would actually take that option in a heartbeat versus actually going into a brick and mortar location? All right. Well, we got the polls coming in. The votes are coming in. So it's about 84% of you guys would definitely go to the option of telemedicine, depending upon how urgent it was. We have 25%. So we have about 75% that would prefer an alternative prefer telemedicine as an alternative, maybe depending upon how urgent, 25%. All right, next slide. Which one of these urgent care cases would you send to telemedicine first? We got the chest pain, the prescription refill, shortness of breath, ear pain, or both B and D. All right, next slide. So the actual answer would be E. So ear pain and prescription refills are definitely low acuity visits that can be seen within 15 to 20 minutes of seeing a provider. They're less complex, they're more straightforward, as long as there aren't any acute symptoms associated with the refill or ear pain. The providers would definitely delineate which patients are definitely appropriate if it needed to be escalated and pushed over to our brick and mortar locations. But those are why that's the convenience of having telemedicine, is having those easy, quick, and in and out visits to be seen by one of our providers, and definitely saves time. There's faster relief for both parents, kids, and the working class, of course. Next slide. So telemedicine definitely optimizes our care during our peak seasons, especially when our clinics are inundated with patients who are there for COVID or for testing for different more acute reasons. The VSee integration definitely did help improve our workflow. It did also help us manage our high volumes and our staffing challenges across the 50 clinics. And it also increased access and convenience for our patients who did live in the rural communities. So those patients who lived in the rural communities are on farm locations, and it would take them maybe 30, 45 minutes to actually get to a brick and mortar location. Not saying that we wouldn't send them into a brick and mortar location if it was warranted medically, but it did give them the access, kind of like a triage, to say, hey, this patient can be seen here, or this needs to be escalated into a clinic or to a local hospital. Next slide. So our virtual platform was started a little bit prior to COVID-19 pandemic, but in COVID-19 pandemic we did see the increase. I did come in post COVID pandemic to the platform. However, it was definitely created to ensure that patients had continued access to quality health care. And it definitely reshaped the way we practice medicine once COVID hit. The way we delivered medicine, we saw convenient ways, we saw ways to reach our patients that we didn't prior to COVID. Next slide. And so implementation of the app was convenient on either the iPhone or Google, and the engineers of VSee were key in helping us to navigate that transition for our patients and how they registered and how they downloaded the app, as well as on a computer as well. Next slide. Our patient volume and utilization trends for 22, 23, and 24, we saw over 35,000 visits each year on 22 and 23. That's because the trend was still more so geared towards telemedicine, people avoiding being seen in center. We did see a drop off in 24. However, that was because there was more access and people were more confident. The vaccine had been introduced and then patients were more able to navigate treatment. Healthcare providers were able to navigate the treatment of COVID and the symptoms that were associated with it. But we still stabilized our volume as well. We still had a great amount of patients that did come and access our telemedicine platform. So I did do a tour last year into this year of our clinics, training our staff on how to get onto the virtual platform. VSee engineers were very key in helping me to navigate that training. I think a lot of hesitation is when apps and technology is being introduced to any staff who's not used it, or older staff, and some people had resistance. So my touring in person and training did help bridge the gap and access and provided newer clinical staff with hands-on and real-time guidance. Next slide. So we did see the increase in the stabilization of the comfortability of the staff members using the in-center training. And it did provide relief for our providers, those providers who had inundated with charts, those providers who needed a break because they've seen 30 patients in the last 6 hours. And it was very helpful in that engagement. Next slide. We did identify some gaps. So there were surges from flu, COVID, strep for our brick and mortar locations, and the in-person wait times were increasing. So we were using this to circumvent patient satisfaction from dropping, provider burnout, as I had stated before. And then also when we have surges like that, we look at how the capacity and the delivery of our services during that time as well. Next slide. So if you could offload one type of telemedicine visit, and you can type it in the chat, what would it be? Prescription refills, asthma, BP medications, COVID, non-complicated. So these simple visits are definitely can be seen within 15 minutes and definitely help with clinical flow. Next slide. All right, pulse check. How many of you already use a virtual platform or have used one in place of going into your doctor physically? And yeah, about 50% have voted. And go back to that slide room. Next. Next slide. Well, I wanted to see the poll. Yeah. You skipped the poll. All right. So about 65% of us already use the virtual platforms on a regular basis, and only for specific situations, of course. And then we had about 20% who have not yet used it, but they were planning on it. So it is convenient, especially when you do have a lot going on, and the convenience of being able to be seen by a provider quickly. So I love being that convenience of the telemedicine. I have 3 boys, and definitely it helps. Next slide. The outcomes and operational impact. So the in-center providers did experience a lot of relief from me visiting and training, and with the VSee's engineers and the staff did also report an improved morale and a manageability for high demand periods. So, and our patient satisfaction scores did increase because they were able to be seen in and out efficiently, and they liked the alternative options of being seen, especially if they wanted to just get their results, get their prescriptions in and out. Next slide. All right, so who primarily benefits from virtual urgent care? We got immunocompromised patients, busy parents, rural populations, or all of the above. All right, next. Next slide. So all of the above is correct. Immunocompromised definitely want to be not have exposure to other patients who have illnesses due to their low immune system. Patients without transportation or in areas where accessibility for our brick and mortar locations definitely are parents and patients who have multiple jobs, and students as well as elderly patients. Definitely it helped to bridge the gap across the Carolinas. Next slide. So definitely key points. It's not a replacement to brick and mortar locations. It's just a strategic extension of the services. So we did service within the clinics, as well as patients were able to access our telemedicine platform from home or from work or from an office. And it did help reinforce the one system with multiple door care philosophy. Next. Partnership with VSee has been amazing. I'll say that their engineering team is very hands-on. If there's any troubleshooting or regulatory changes that we needed due to CMS changes, Medicare changes, or notices that we needed to blast out to our patients, VSee was there, definitely there, direct communication. Changes were made within 24 to 48 hours, and we did build a very strong partnership, which enabled immediate adjustments for patient safety and our operational needs, as well as our compliance. Next. So outcomes and impacts, what was one of the major benefits reported by in-center providers? Free lunch every day, relief from burnout and more urgent cases, less charting responsibility, or shorter staff meetings. Next. Next slide. Relief from burnout, of course. They were able to have a improved workload balance, reduce the stress and the fatigue, and it definitely did enhance the patient quality and their care. Next slide. On the horizon, we look toward the expansion of telehealth and its integration. We're we did speak of some of the leveraging tools that AI will definitely provide in the future. And Dr. Chen, definitely you can talk about that. As I know that there are extensions of different tools such as otoscopes and stethoscopes that are coming on the market, as well as centralized virtual hubs and advanced sustainable hybrid miles supporting college students, teachers, and families. Next. Lessons learned, the hands-on and in-person training definitely accelerated the adoption of using the telemedicine. I think the comfortability of patients as well as staff members using the app was definitely great. And then we do also have virtual visit assistants. When patients are onboarding onto our system, they did have the ability to chat if they were having troubleshooting errors or issues on getting on board. Next. And the takeaways from this, telemedicine is definitely a critical support system during peak seasons. I think it's amazing to see the expansion of care that we can provide for our patients as a provider. It also offsets patients from having to be seen in the ER, which definitely reduces the cost of that copay. It also simplified operations for both patients and the providers as a whole, and equity across the regions. Next slide. And the underserved areas, I think that's the biggest thing too. Like we're so used to living the city life. I think rural communities are very overlooked in a lot of senses, that patients do still live on farms and patients do live further from brick and mortar ERs and health systems. And I think that this definitely was an eye opener for me as I became more in depth with my position as director of telemedicine. Next slide. Any questions? You can put them in the chat, and then Anne will answer them.
Hey, Natalie, thank you so much for sharing all this your insight in that. For audience member, please just pour the pour the question in that will answer live on the air. Maybe while the question come in, Natalie, so in a way, I've worked with many of these were urgent care centers. They attempted to offer telemedicine. I noticed is a lot of the people that struggle was offering telemedicine urgent care center. When they run the numbers, right, they find it's actually not profitable in this. Is it okay to ask, like, for example, how do you make your system successful? Like, is it profitable? I mean, you guys are part of a very large system in this, right?
We're a larger system. I think visibility and our impact within the community, and then also their patient satisfaction plays a big role in how patients receive care. So word of mouth, if you receive great care from our location, they're going to spread it on to their aunt. They're going to spread it on to their coworkers that, oh, wow, this is a great, convenient way to be seen. And we've seen that reflected in our patient satisfaction scores. Also participating in marketing events, promoting the platform, definitely helped, because a lot of people did not know that this was an option for them. So once patients did have knowledge that this was an option for them, the easier it was to increase our visits, increase the visibility, and also the care that our providers give to.
Got it. Is it okay to assume is, like, for example, I see a lot of times these are big hospital healthcare system, they offer telemedicine or urgent care almost as a way to acquire patient, like that by itself doesn't need to be profitable as long as you keep the brand on the overall things in there. Or is it possible for these for a standalone urgent care of telemedicine for that by itself to be profitable? Like,
it is possible. I think that being an extension is definitely that option for patients, definitely gives them that peace of mind that that is an option. when they
Mhm.
can't access their doctor. A lot of patients are having difficulty getting into their primary care physician. The average wait to get into a PCP right now is 6 to 8 weeks for a regular.
Yeah.
So if they need a refill on their blood pressure medication, or if they had
Yep.
needed an asthma medication refill, or they have a cold, urgent care systems are definitely a great avenue for
Yep.
patients to bridge that gap.
Got it. That makes sense in there. Another question I have is like often it's like staffing, especially for like a big enterprise like you guys are. I'm pushing a lot of challenges, right? You run such a big, operations in there. Do you find that physicians are they willing to take like less pay if they do like telemedicine work, especially if they could like work from home in there, or they really expect the same pay? Whether they go to the clinic in person or
Well,
remote.
that's above my pay grade as far as whether or not, but I think they like the convenience of being at home, the hybrid model. A lot of working career minded people like myself, navigating families, navigating life.
Yeah,
I think the convenience of being able to work from home and see patients is definitely a plus. I think overall, if you're a provider, you love what you do. You love giving care. You
mm,
love being a resource to patients.
mm,
Patients being seen at home definitely are in a more relaxed environment and they open
yeah,
up more. So you get more
yeah,
information from them. Um, and I feel that the convenience of the telemedicine definitely provides that for us as providers as well. It's a two-way
got it,
street.
got it. Yeah, that makes a lot of sense. Part of the reason I was asking about this, right, these days, right, just like, healthcare becomes so expensive. Like, for example, I'm in the Silicon Valley here, right? Just like, if there's some way to, it's like trim the cost down a little bit. So I think maybe like the consumer will benefit. At the same time, of course, we have to be fair to the clinic, the physicians as well. Yeah.
Definitely. And I think too, just the discernment of our providers, knowing that when a patient actually needs to be seen in person, it definitely takes key spidey senses,
Yeah.
great clinical background, and really probing the patient and asking those key questions as to
Yeah.
whether or not they need to be directed for a higher level of care.
Yeah.
Because you could miss it. Telemedicine is not
Yeah.
unique in that everything could be seen on there. No, it's not in replacement of a brick and mortar location. That to
Yeah.
be clear. And I think that it's just a bridge, I say, as an extension of the actual brick and mortar locations, which provides patients
Yeah.
that convenience and satisfaction.
Yeah. So now the class, so right now, for example, there's a lot of it's almost like a quote unquote semi unscrupulous pure telemedicine play, right? They just like want to pump you with a drug or whatever thing. Versus, of course, you guys had a hype, they can always come into in person to get in the right. How do you compete with these sort of pure telemedicine? They just were like, I push with the quality, they're not aiming for your standard, but then they just using price as a driver. Do you worry about those guys? Or like,
I honestly never worried about it because of the way that we delivered care and the passion that we had as a whole, and responding to our patients if they had questions, responding to our patients if they were missing a school note. I think when you deliver medicine with heart and being, as long as we've been in establishment of South Carolina and being part of the community, I think they feel like we're the
yeah,
peanut butter and jelly of South
it's,
Carolina. So
yeah, you
there's really, it's like that mom and pop feel where patients have the assurance that they're going to receive the care and get their needs met as well as their medical needs met. So that's
that
why we
makes
get
sense.
the mom, the aunts, and the pre-pack of kids that may sign on or may go into the brick and mortar locations.
Got it. That makes sense. So we have a question from the audience member, Rita, asking about, do you have challenges with senior citizen not able to connect with the telemedicine technology?
Yes. Yes, they
How,
do.
how,
Oftentimes with our senior patients, if the VBA is not able to walk them through some of the steps, uh, v, we will call them to teach them how to go through and actually download the app. Or usually their family member will assist. They usually have a family member assisting them on how to onboard on the platform. And then we've also found that accessing it through the web is also easier for our senior citizen patients because
Okay, no
a lot of
download.
phone. Listen, I still hand my phone over to my kids to navigate certain apps and everything. I don't know everything about the iPhone.
Got it. We have another follow-up question of a reader is, are you only providing in South Carolina, or do you expand in other states as well?
We also see patients in North Carolina too because we border some of the areas. So our providers are also licensed in North Carolina, but the patients actually have to be physically in South Carolina to be seen. We do get patients who visit for vacation and they're visiting South Carolina and can be seen on our platform. But outside of South Carolina, North Carolina, no, those are the only locations that we service.
Got it. Do you guys plan to expand to other states as part of you guys' corporate strategy?
I know that's a future question. I don't have knowledge of this yet, but I hope that we can continue to deliver the quality care that we're already giving, if not better, for our patients.
Okay.
It's been
That
an
makes
honor
sense.
to serve the patients of South Carolina.
Okay, wonderful. So another, so you mentioned rural health in your presentation there. So under President Trump, there's like $10 billion a year for next 5 years on the rural health transformation in this. I guess, are you guys see a strategic play because since you already provide services in these rural communities, are you guys plan to, I get, fold into some of those programs where like,
I think that we already service a lot of the rural areas of South Carolina, although in depth, that's yet to come. Since we are still growing and we're still developing new ways to reach our patients. And I just feel that there is a sensitivity in really adopting more key protocols for our patients who do live in those rural areas, as far as providing them with information for accessibility, whether it be through a mailer, whether it be through an email blast, whether it be for reaching out to them. I think definitely it's needed, and I do foresee it coming in the future.
Got it. Because I think where I was going at in there, it's a lot of the rural communities, sometimes even the setup of brick and mortar urgent care clinic might be just, it doesn't justify the cost, Maybe you can create it like almost like a health pod, which is like super skinny down
That
version.
would be
Now you can
amazing.
really reach out to, spread to the churches, community center, not really like spread within the rural setting.
I agree with you 100%.
Okay, sounds good. We have some kiosk solution. Hopefully we can help you guys deploy there. Um,
Now, if I
Natalie,
win the lottery tomorrow, that'd be a different story.
yeah, yeah. Natalie, can I ask another question? Like you mentioned AI in your presentations, right? So what are maybe your wishes, as well maybe fears, what these were, the AI, the onslaught to the whole like entire healthcare industry is there, like what?
I think with the AI thing, I think the key part of AI helping providers is the documentation, helping
Yeah,
their workflow go faster so they can see more
yeah,
patients conveniently.
yeah.
I think it will help us to reach more patients using that. I don't see it as a replacement for diagnosis. I don't see it as a replacement of the provider because we have
Yeah.
to learn medicine every day. It changes every day. Protocols change every day. New diseases pop up that we
Yeah.
still have to research and gain more knowledge of. I think AI definitely as a key tool for documentation, definitely, yes. AI, I've seen a lot of apps now where patients are able to open their mouths on the screen and they're able to diagnose strep throat right on the screen. And
Yeah.
it doesn't replace them being seen in person
Yeah.
by a provider, but it definitely helps to bridge the gap again, like I said.
Got it. Then what about, do you see people like with the chat GPT, like the cloud and all these getting more and more advanced where people just like instead of even they just like almost like ask AI to self-diagnose, trying to instead of even like go call or like go see an urgent care doctor.
I think it's the new Google. It used to be Dr. Google, and now there's
Dr.
Dr.
Google,
Chat.
yeah.
Now it's Dr. Chat GPT. So of course, patients
Yeah.
are going to lean to use
Okay.
some of the AI technology to try to self-diagnose, but it doesn't replace an actual clinician with the knowledge and the medical experience that they've had to actually truly safely treat and
Mhm.
diagnose and evaluate a patient in person.
Got it. Okay. So we have a question from the audience member asking about, like how do you have any best practices? How do you reach the underserved population? Because of course you operate a lot of the footprint where, there's these underserved populations who's I'm assuming they might have like limited access to digital access and maybe tech literacy. Like how is there any practical tips you can share with the audience members?
I think, like you said, um, reaching out to some of the churches through our marketing, through mailers, um,
Okay.
advertising. We do also have Facebook accessibility. We also have Instagram accessibility. I think there are many means of reaching patients in the rural areas through family members, through local churches, through some of the community organizations, the larger ones that do service the rural communities or their regular newspapers that we're here to service the
Mhm.
community. I think those are the ways that are definitely beneficial.
Mhm. So you got it in there. So how about in terms of like the reaching like the really hard to reach? Do you have specific program to just like, working with the church, like a lot of things you just mentioned in there, like,
Not as of yet. Not as of yet. We're
okay,
still in transition with a lot of changes, but I,
okay, okay, got it, okay. Um, and another question is, so a lot of time when you have these sort of large, these were urgent care practice in there. So right, you could have these were like a dedicated tele-urgent care staffing, right? These physicians, they can work from home, whatever. All they do is do tele in there. Then what you can reuse your existing brick and mortar physician to do telemedicine there. Then the
we
thinking is if you do you have any like yeah, staffing
so we
model
have
you recommend?
yeah, our staffing model is so we have physicians that actually work in our brick and mortar locations, and then we have those that come on as needed. So they have
Yeah.
PRN shifts. So they come onto our platform and actually work the telemedicine platform from home. It's a hybrid model. Yes, they can also log in to the clinics. The staff would log in the patient
Mm-hmm.
and they would be seen by one of our providers. So like let's say Dr. Chen, you're at the clinic and I'm the provider seeing you. I'm at home, you're in the clinic, and I can see you from that clinic.
Yeah.
But
Yeah.
for the most part, we usually staff um, through our laptops and we see the
Yeah.
patient and throughout the state of South Carolina.
Got it. Got it. So for your patients in there, are they mainly like Medicare, Medicaid, private insurance, cash pay? Was really just like, is there any concentration? Or is pretty much just like everything? Like,
We have all options to see those patients.
okay.
Yeah.
Got it.
There are stipulations for Medicaid patients. There are stipulations for patients who have self-paid that we have options for them to be seen on our platform.
Mhm. Got it. Okay. Do you have any, so for example, right now there's on the movement on the congressional side, the idea is like if people, the Congress gives us, the consumer money into a health saving account, right? Then they can have these sort of choices, have more like a cash-based model rather than an insurance-based model. So I might able to decrease the cost of healthcare. Do you see, like offering these or more like if you're coming through a cash base, you give them some incentives that can to decrease
So,
costs in some way. What do you?
so I work really closely with the billing department, and we stay abreast of the CMS laws and the billing laws and the insurance laws. So I don't have an answer directly for that. It's just we really
Okay.
have to keep up a close eye on how those laws are strict. And so we have to adhere to them the best way possible, because even with prescribing, there are certain prescriptions that we cannot deliver over a telemedicine platform. They must be seen in person to be seen
Mm,
and receive those.
okay, got it. So I have a question from the audience member. Thomas is asking, do you see specialty developing, not necessarily a physician, like to deliver this type of services? Is open
I
like
do.
using like a
I
non-physician?
think
Yeah.
I think they're already in development.
Uh,
Orthopedics has a telemedicine option. I think even veterinarian has telemedicine option.
yeah.
Now there's telepet. So there's so many ways that telemedicine is definitely, I think that it's here to stay. I think that it's the new wave of medicine, and I think that
Okay.
there's room for expansion and many different avenues, specialties, and
Mm,
a way, again, for patients to be seen, for sure.
yeah. Got it. Okay. Perfect. We have another question from Sanal asking, have you used or plan to use telemedicine urgent care for cardiac patients? I know in your presentation earlier, there was, I think, things like chest pain,
We
some of them. Yeah.
we are primarily an urgent care center, so
Okay.
we don't specialize in cardiology.
Okay, got it. Do you ever expect to offer some of these services? Because I imagine, especially in the rural setting, maybe they have no other options. They really gonna lean on you
That
to,
would
yeah.
be that would definitely be medical operations planning in the future. But I
Okay.
do think that it would be nice to reach our patients who do have cardiac issues and bridging that gap to them to receive care. So I do foresee in the future that maybe that becoming an option, but not sure
Yep.
necessarily at our location.
Yeah.
We're strictly urgent care medicine.
Yeah, yeah, that makes sense in there, especially when you get to some of the potential cardiac, it just the potential risk is so so massive. Yeah.
Yeah, it's
Um,
higher.
we have
Definitely.
a yeah, we have another question from the audience member asking, so you mentioned leveraging AI for documentation. The question is, how is patient privacy handled that, guarantee even if you use this AI, there's no HIPAA violations?
Um, Definitely it has to go through our IT department and our security systems for any EMR that we plan to adopt or incorporate into our system. We do keep
Mhm.
electronic medical records through our EMR system that we document our patients' visits in. So any AI or any foreseeable future of AI being implemented into our clinic, it would definitely have to clean sweep evaluated by our IT and security department before it was
Got it,
implemented
got it.
operation.
Yeah, that makes sense. Maybe just maybe I could add in my spin with for that. And that's right. Like when you're doing AI, in some sense, there's not magic. All of a sudden, HIPAA doesn't apply. So all these things still apply. You have to make sure from the engineer how they handle database, all the rules still apply. Yes.
Yeah, we
We have a
definitely have to go through an extensive HIPAA regulation and compliance regulation before we implement anything new into our clinical operations or workflow operations.
yeah. We have a question from another audience member asking, so do you provider have to be ACLS and PALS credential?
I will get, if they leave their email for us, I will get them that answer.
Okay, perfect. Okay, great. Um, so, by the way, so in terms of like there's some legislation in terms of things like the telehealth parity laws, all these different things. How do those things, does it impact your profitability or operations or?
You know, we've had waves of where our visits had to change because of the CMS laws and because
Mm,
Medicare was billing differently, but it quickly changes with so we just have to stay abreast of those laws. I haven't really seen a dip in that respect, but it's one thing that now that patients are able to be seen more in the brick and mortar locations, as you saw from 23 to 24,
Yeah.
that we do see a dip in that sense. We remain stable, but we did see a dip in our numbers in that respect.
Got it. Got it. Okay. So we have another question from the audience member. How do you imagine using the devices to extend your capability? Mainly these devices, you can give these were like a fairly low cost, consumer, like these were like different diagnostic devices. Yeah.
I think that it would definitely bring an innovative sense to
Okay.
a telemedicine visit if we had those tools, if we had a step
Yeah.
that we could auscultate virtually for an asthmatic
Yeah.
patient, if we could conduct different exams to determine if a patient needed to be seen in person.
Mm.
I think those tools, or even the otoscope, being able to see within a patient's ear, those are some of the tools that are definitely in development, if not already developed, but have not yet been
Okay.
implemented on our platform per se. But I do
Yeah.
see it as being innovative and definitely forward thinking. As you could see on Elroy, the doctor could see through the TV.
Got it. Got it. So, Natalie, how about in terms of like the from urgent care to expand out into things like some of the chronic disease management in this? Because I imagine it's a lot of time for these patients who are struggling getting primary care appointment, right, in there, like, but it's almost like you almost have everything out of the capability to handle like these routine chronic disease as well. Do you see that as extension to your business?
I don't necessarily see it as an extension, because here's the deal. We can definitely bridge a prescription for a patient who needs a
Yep.
blood pressure medication refill or an asthma refill, but I don't feel like it should extend beyond us refilling it, because they need consistent monitoring management with someone that's going to
Mm.
see them on a regular basis. It's like if you're working in the urgent care, you may not see the same provider on the same day. Everybody works
I see
different
it.
shifts. It's kind of similar to an ER in a sense. So I definitely think it's very important that people understand the differences between primary care, urgent care, and ER medicine
Okay.
care.
Got it. Yeah. Do you, we have another question from the audience members saying, like, do you see these for like as technology become more and more part of the thing, you could potentially widen like the digital divide? Or do you see this is really by making technology the lowest common denominator, you could really pull people out?
I, I think it's symbiosis at this point.
Okay.
We didn't think we would be where we are today. I mean, 60 years ago, I was watching the Jetsons. That was 60 years ago. And now I can actually see everybody, and I'm on a webinar with you. There's the capabilities and technology as we advance and as we have new discoveries, and medicine changes every day.
Mhm.
So to say definitively or an absolute no, I do feel that as we evolve, we'll find new ways to deliver medicine
Mm.
and to create pathways for patients to receive care. I think that's the
Yeah.
highlight. Anybody in healthcare, I think our main goal is to ensure our patients are
Yeah.
cared for and that the care delivery is up to par to get them to wellness.
Okay, that makes sense. So, Natalie, you ran one of the like a biggest, I think, like the urgent care operation around the country in this, right? Like, as you're scaling this thing up, what are some like big challenges you said, like doing that, like things like EMR integration? Is it like training the provider? Is it like just marketing to the consumer? Like, what are some top things that like people should watch out
I think the reach to the community is definitely one of the challenges in making sure that they know that we're there, that we're there to
for?
support, and that they have this avenue to receive care. That's number one. And the other challenge is, as we are moving through different illnesses and diseases and identifying them, making sure that our clinicians
Mhm.
are well prepared to handle
Okay.
whether or not for them to go in clinic or be seen on telemedicine. And the third thing is evolving with technology, keeping up with the way that things are evolving and the way that we service our patients.
Okay, got it, got it. So I have another question from the audience members. So do you go after things like employer or like these contracts directly? Because we see it, often like if you're close to like a big company, like things, right? You could put an urgent care center like inside a factory, inside like a company in there.
That would be nice. I mean, we partner with different companies as a whole, but I'm not sure that that is the direction that we're going in right now.
Okay, got it, got it. Okay, there. Um, this is like, Natalie, I just want to say thank you so much for sharing all your, like, I know I've been flooding you with the rapid questions. So thank you so much for sharing all your wisdom.
No,
It's been
it's been great to partner with you all. You guys have been such a key part in me learning technology as well as integrating it and delivering it to patients, and definitely have been a great support to our South Carolina community and our clinics. And definitely, I've had nothing but great things to see that telemedicine is here to stay,
oh,
and it's only going to keep growing from here.
okay. I really appreciate your kind word. Well, one of the audience members just sneak in a last minute question.
All
If
right,
you're
it's
asking
the
like,
best for last.
I know, yeah, I know we cover like, I think you guys not expanding beyond South Carolina, but she's asking, do you have any plans to expand into New York, or do you have any partners in New York at all?
We don't have partners in New York, and that is yet to determine on the trajectory from leadership as to which way they're going
Okay.
to infiltrate the market and which other states that they decide to expand to.
Okay, great. So Natalie, as we wrap up this, I wanted to maybe ask you some question, just maybe slightly unconventional questions in there. So the first question is,
Okay.
what is this like one thing that you believe about healthcare that no one else believes yet?
I believe everyone should have access to healthcare. I believe that.
Yeah,
I really do. I believe that care is very important to our patients and listening, and definitely delivering medicine in a way that is effective to empower your patients to actually make the changes they need to wellness
yeah,
and to give them enough information so that they can make the changes on their own.
yeah. But how will you respond if people come and say, well, we cannot afford it, right? Like, how will you counter that?
That I in my rainbow land mind, I think everybody should, but I feel that there should be ways that patients should receive care. I
Yeah,
don't know how the construct of
I
the future would be, but in an ideal world, everybody would receive care.
okay. I think you should run for president. I think a lot of
I
people
know, right?
will stand behind you and say, yes, you should give everyone healthcare. Yeah, I'm definitely on the bias in the yes, it's expensive. Yes, a lot of things. It is, if we can't even offer healthcare to our citizens, to our people live here, then like, what else is there to do? Like, you got to take care of the healthcare first. Um, then my final question is, supposedly you can whisper idea, just like the movie Inception, right? If you can plant the idea into how the Human Services Secretary Robert Kennedy Jr. Just you plant this idea in there, and he just go implement it. But you can only do one idea. What is this idea you want to plant in his head?
Um, I think making telemedicine accessible and convenient to everyone. I really do. I think being a part of this platform definitely showed me how medicine could be delivered differently, and I just feel that everyone should have access to it.
Yeah.
That's my only
I can
idea.
definitely.
That's my only
I
idea.
stand behind that. Okay, I appreciate that. I thought you might share something slightly controversial, but it's
No, 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 I don't rock
this
the
is this is good for a family safe audience member.
boat. Yeah, absolutely.
Uh, thank you, Natalie, for sharing your insight on virtual urgent care operation and impact. Really, really, really appreciate it. And I just want to also thank everyone for joining us this week. And we'll be sending out the recording, the slides following the session. And if you have anyone to follow up, Natalie around, and she should be, I'm pretty sure there's tons and tons of wisdom, and definitely reach out to her. Because
Definitely.
Natalie, I
Thank
just want to
you,
say thank you
Dr.
so
Jen.
much.
Thank you. Bye, everybody.
Okay, bye.